Good afternoon, everyone. This is the Jersey County Health Department Board of Trustee meeting for November 30th, 2023, 4 p.m. roughly. Before we get started, if everybody please mute your phone. Good afternoon, everyone. This is the Jersey. Thank you. So now we're going to move forward. Please mute your phones. If you haven't done so, I appreciate that. I'm going to call this meeting in order. Ms. Pinkley, roll call, please.
Mr. Pig?
I'm here.
Mr. Deal?
Here.
Ms. Stidham?
Here.
Dr. Henry?
Here.
Ms. Davis?
Here.
Thank you. We have established a quorum. Mr. Deal, would you please read the mission, vision, and purpose of the health department?
Excuse me. The mission of the Jefferson County Health Department is to champion positive health outcomes and behaviors through innovative programs and community engagement. Vision of the health department is advancing the health and safety of Jefferson County. And the purpose of the health center, as included in the revised Missouri statutes, is Jefferson County Health Department is established, maintained, and operated for the improvement of health of all inhabitants of Jefferson County.
Thank you, Mr. Deal. Next order of business is approval of the agenda. We know we have a couple of addendums we need to make. Ms. Stidham, you have one you want to do?
I would like to make a motion to move item number 3 under new business to the next meeting, please.
All righty. So we have a motion to move number 3 to the next regular meeting.
I'll second.
Second.
Is there any other discussion? Is there any discussion on the matter? Not hearing any. All in favor, please say aye.
Aye.
Any opposed? Motion carries. The next one, I think we were looking to move number 2 to the next regular meeting as well.
I make a motion to move number 2 of the approval holiday schedule to December 20th.
Thank you. Do I have a second?
I'll second.
All right, having first and second, is there any discussion on the matter?
So is the reason we're moving that because we're gonna have different dates than what's on that sheet? Or another reason for the holidays?
I'm not for sure what the reason was requested, but they just asked for it to be moved, so we're gonna
Scratch
move
it?
it. Okay, yep. So anyway, we have a first and second, all in favor to put that to the next regular meeting, please say aye.
Just one quick.
I'm sorry.
Aye.
Hold
So
on.
the next meeting we're saying is the 21st of December. Is that correct?
The next board business meeting.
Is
it
the
the
21st?
21st or the
21st. Okay, correct.
21st.
Okay. Got it. Great. Thank you.
So now we got that clarified. All in favor to approve amending removing the 2024 holiday schedule to the next meeting, please say aye.
Aye.
And Susie already said aye. Any opposed? No, all right, motion carries. Any other addendums? So now that I ask for the approval of the amended agenda.
I move to approve the amended agenda.
I have a second.
Second.
Having a first and second, is there any discussion on that? Not hearing any, all in favor, please say aye. Aye. Any
Aye.
opposed? Sorry. Any opposed? Motion carries. Welcome guests. I know there's Mr. Alan Lederbrand, and we have our esteemed leader representation. All righty, so the next order of business is approval of the October 2023 expenditures. Do I have a motion?
I have a motion to approve expenditures
Sorry, I apologize.
for October.
And that is for, sorry, for not having that in my head.
26,000.
Thank you.
$6.32.
Thank you. Have a motion. Do I have a second?
Second.
All right, the first and second, is there any discussion on the point?
Mr. Chairman.
Yes, Ms. Davis?
$26,000 for our monthly expenses is super, super low. Usually we're, at, 250,000, 350, 450 or more thousand, why would this be so low this month?
This is just the check voucher register.
Check vouchers, that's not the entirety, that's not the electronic payments.
Right. So I don't even see our attorney's bill on this itemization as well. Is there a reason for that? I know she just billed us on the 24th, so that's probably the reason, right? We're not getting a bill for this month, just gonna get it on the following.
It's in the packet.
The legal expenditures were in the packet.
Right, I have them. I have them. It says that she billed us on the 24th of October, and it looks like those expenditures are going into all the way through the 23rd. So her bill is not going to be on the
Paid in
bucks that we're
November.
paying this month. Correct?
It'll be in November, or the November. Kristen, you want to get them explained, please? I'm sorry.
It says at the top of the page.
I understand that.
The legal expenses, the check was cut in November. So you'll see that next month on the check register.
If you look at the top of the page, it says check date 11/8.
Okey-doke.
So it could be on the October expenses.
Thank you for the clarification. Appreciate it.
Okay, is there any other questions? Not hearing any, all in favor of approving the October 23 expenditures, please say aye. Aye. Any
Aye.
opposed? Motion carries. Thank you very much. Next is approval of the October 2023 electronic payments for $473,529.11.
So moved.
I have one motion. Do I have a second, please?
I'll second.
Having a first and second, is there any discussion on the matter? Not hearing any, all in favor, please say aye. Aye.
Aye.
Any opposed? All right, motion carries. Pre-approval of the December 23 electronic payments. And that was for an estimated amount of, I don't have that.
$602,365.52.
Do I have a second for the December electronic approval?
Second.
And first and second, is there any discussion on the motion? Not hearing any, all in favor, please say aye. Aye.
Aye.
Aye.
Any against? All right, motion carries. Next on our agenda is clinical is the director's report. I apologize.
Okay.
Ms. Lawman?
Ms. Farmer?
Good afternoon, everyone. Just a couple highlights. You have your clinical services full report in your packet. Just wanted to highlight from October, the flu vaccines that we provided both at our in-house clinics and in the community. You can see from your report that the largest portion of our influenza vaccines were provided directly in the community. A lot of those were done through coordination with our school systems in Jefferson County. So I just want to give a huge shout out to the school nurses who helped us coordinate all of these events and also helped ensure those events ran smoothly, answered questions, and worked with our teams throughout the month to make sure all those service needs were met. So really appreciate our school nurses. The other thing I wanted to highlight for you all is that our clinical services team, our community team wrote for a grant through the Jefferson Foundation to help support the purchase of a new mobile healthcare unit that will house our mobile wellness program going forward. And we were really excited that we were granted the full amount that we wrote for. And we also worked to supplement that with some additional funding. So we will be putting together an RFP so that we can go out to bid for the development, the design, and the fabrication of a new mobile healthcare unit. Any questions about that or anything else on the report?
Yes, Ms. Parmalee?
Yes, ma'am.
The amount of the grant?
Yeah, the foundation grant was $250,000 that was awarded.
And the approximate cost of the new van would be?
We haven't gone out to bid yet, but we did get some initial quotes through our coordination at the Mobile Healthcare Conference. And it looks like the cost may be upwards of $400,000 or a little bit more. So with our grant funding and the way we have coordinated this, we should be able to cover the full cost.
Sounds good.
Were there any other questions? Thank you very much.
Chicken.
Hello, just a couple updates for me as well. In the packet, I just wanted to highlight the mosquito control program has officially ended. October 31st was its last day. So we had some preliminary numbers from our mosquito season this summer. They collected 2,751 female mosquitoes that were able to be tested. They ran 81 tests with 9 positive for West Nile virus, which is what we test for. They had 388 different spray locations that they did around the county for unincorporated Jefferson County, our county parks, fairs, festivals, anything that was asked for that is in our jurisdictional area. So I just wanted to highlight that. Those are preliminary numbers, so final numbers will be on our annual report, but they did very well this season. I'm kind of skipping around in my packet. I wanted to highlight our adult brain injury program. They went through their contract monitoring, which is their annual audit, and they went through with flying colors. There was no finding in it, so we are good for another year. Same with our children and youth with special health care needs. Theirs was the month before, so both of those programs are doing great. And passed all their grants.
Can I ask a question about the adult brain injury? Could you give us an example of how those funds are used for that, what it would be used for exactly?
Yeah, so we kind of are a subcontractor of the state, so we house the employees. There's 2 employees for adult brain injury and 2 employees in the children and youth with special health care needs. And they act as kind of resource navigators, case management. So for folks with the adult brain injury are injuries, not something that, not a medical condition you're born with. So you've had an injury or an accident. They work with that client and other providers in the county that they're in to try to get them whatever services they need. The goal is for them to be as independent as possible. So if they need help getting tablets or cell phones or like vocational services, we are kind of the middle person between that. So the state funds it. The cost of the program doesn't come through us. We just house those employees.
Sounds good. Thank you for the clarification. Appreciate it.
My other big announcement is that our environmental lab tech is retiring this month after 46 years, which is amazing. With that, she's kind of a one-person show. So as that position left, we had another staff that we were training to take that position over. They actually left us as well to go to a different company. So as we sat with not having anybody in that position right now, it was a good time to evaluate what that program looked like. After that evaluation, we've come to the conclusion that we are going to close our environmental lab. It costs us about $40,000 to run every year. After you take out salary, fringe, supplies, we do have some fees coming in, but they don't offset what the program is. When we started the lab, the state laboratory did not have courier services. So we were really the only option that the county residents had for private and public water testing. We now have courier services that get pick up from our building and from Mercy Jefferson. And the state has programs that public water is actually free to go to the state lab. And for private residents, it's actually cheaper than to come to us. So after going through that, we made the decision to go ahead and close that environmental lab at the end of this month. Questions on that?
Thank you.
Thank you.
Thank you.
Thank you.
No, need the presentation up first. Sorry, we're just getting our stuff loaded. I'm switching things just a little.
Tammy, could I ask what were the changes we made on the agenda? Because you said you kind of did it quick, and I just wanted to know which ones we are not going to do.
New business, number 2 and number 3.
New business. Oh, gotcha. So scratched on 2 and 3.
Yes, ma'am.
Okay, gotcha. Thank you.
You're welcome.
Today, I have asked Mr. Dean Linneman to join us. He is the Executive Director of the Joint Oversight Task Force for the Prescription Drug Monitoring Program. That's going to be the new state PDMP. What I would like to do is just give you a brief overview of the new PDMP that the state is implementing next month and answer a few of the questions and concerns I know that members of both our board and our community have in terms of kind of what is the data they're collecting, what are they using it for, and things along those lines. Yes, sir.
Sorry, Kelly. Some folks might not know what PDMP stands for.
Sorry, thank you. The Prescription Drug Monitoring Program.
Okay, sorry.
And then what I'd like to do after that is just open the floor, and Dean has been gracious enough to come and be open for questions and answer any concerns that individuals may have. So going into the first slide. There is a continuing need in Jefferson County for a PDMP. Jefferson County had the 4th highest overdose mortality rate in Missouri, regardless of drug type, for 2017 to 2021, and the 6th highest for inpatient non-fatal overdose rates from 2017 to 2020. Another report from the Missouri Child Fatality Review Program just came out, and in 2022, the deaths of 42. I will get my tongue untied here in a minute. In 22, the deaths of 43 children related to fentanyl or fentanyl mixed with other drugs. Of those, 20 were between the ages of 15 and 17, and 20 were under the age of 5. The overall number of fentanyl-related drug or child deaths nearly doubled, with deaths for children under the age of 5 increasing by more than 500%.
That statistic's not just Jefferson County, that's statewide, or?
That is statewide. And then just substance abuse consequences in Jefferson County. Residents had a total, again, looking at 87 drug-related hospitalizations, 418 drug-related ER visits that did not include a hospital stay. Looking at law enforcement, Jefferson County had 611 drug-related arrests in 2021. We'll go to the next one. Just kind of setting out where we stand still. In 2017, St. Louis County implemented a prescription drug monitoring program. As part of that effort, 75 cities and counties in Missouri, including us, adopted a local ordinance to authorize joining the St. Louis program. So at that time, Missouri was the only state in the nation that did not have a prescription drug monitoring program at the state level. So one was created in St. Louis County, and they opened it up to other counties to be able to join. We passed an ordinance in May of 2017 to establish a PDMP program in Jefferson County. And during that same time period, we entered an intergovernmental agreement with St. Louis County to allow St. Louis County to collect, store, and safeguard our PDMP data for us. Next. What's happened is in May 12th of 2021, the Missouri legislature passed Senate Bill 63, which authorizes a statewide prescription drug monitoring program. So Missouri now has joined the rest of the country in having a statewide prescription drug monitoring program. 195-600 created a prescription drug monitoring program in all of the Missouri counties. So all Missouri counties are required to participate. It will become effective December 13th. as part of that process, there is a joint oversight task force, which Mr. Linneman is over, for prescription drug monitoring. And basically what that authorized is the supervision to supervise the collection and use of patient dispensation information for for prescribed schedules 2, 3, or 4 controlled substances as submitted by dispensers. So this was a bill that was sponsored by Senator Holly Ryder and signed by Governor Parson. Again, just kind of highlighting the go live date for the statewide PDMP is scheduled for December 13th. So the statewide PDMP will be fully operational on the 13th. All historical data that has been approved by participating counties like us will be transferred to and available in the statewide PDMP on December 13th for approved. On the 13th, all dispensers within the state will be required to report to the PDMP, and the St. Louis County PDMP will cease operations. So basically, as of the 13th, this rolls into the statewide system. Next slide. So the PDMP is to reduce abuse and misuse of controlled substances such as opioids and making information available to prescribers, dispensers, and healthcare providers in order to make informed medical decisions. It helps prescribers, dispensers, and healthcare providers identify patients who may be misusing prescription opioids, but also it helps to identify polysubstance in terms of if you have individuals who are seeing multiple providers who may be getting prescriptions and may not have told their other providers about that, the system allows them to be able to see for potential interactions between those. Next. The information that is sent to the PDMP is very specifically outlined in this section. So the information that is on this list is the list. It cannot change without a change to the PDMP law. Basically, it's the DEA number, the date of the prescription or dispensation, and then the prescription number, whether it's a new or a refill, and the prescriber's DEA number. So like a normal, basically any prescription, the NDC code for the drug dispensed and the quantity and dosage, and patient identification number, including but not limited to, it could be their driver's license number, a government issued ID, insurance card, with the patient's name, address, and date of birth. Next slide. So again, this is where I want to go more so into the thing with the state system, and one of the changes I really was impressed as they've been moving forward is there's a lot more restriction of what that data can be used for. It is very specifically geared towards healthcare providers being able to help clients make health decisions. So the information that is in the PDMP is protected health information. It is subject to all of HIPAA laws. The information can only be accessed and utilized in accordance with HIPAA law. The information and any individually identifiable patient information is confidential and cannot be subject to disclosure under subject. Can you go back real quick? No, you're good. The one thing I do want to say is that the Oversight Task Force can provide data for statistical or research and education purposes, but the information can only be shared after the removal of any items that might be used to identify an individual, prescriber, dispenser, or recipients of dispensation. So it has to be cleaned data prior to being able to give to outside resources. Next. The patient information, another change from St. Louis County, patient information shall not be provided to local, state, or federal law enforcement or prosecutorial officials, both in-state and out-of-state or regulatory boards, professional or otherwise, other than for the purpose set forth by HIPAA. So normal exchange. The information submitted to the PDMP will not be used by local, state, or federal authorities to prevent an individual from owning or obtaining a firearm, and will not be used as a basis for probable cause to obtain an arrest or search warrant as part of the investigation. Next. In terms of who actually has access to the PDMP, there is no interstate sharing of data allowed under the state PDMP. So it will be remaining in state. The prescription information will remain in the PDMP for a maximum of 3 years. After the 3-year period, the information will be deleted from the program. So that is another change in terms of it's not infinite database, it is going to be after that 3-year period. Individuals can still request a copy of their specific information that has been reported to the PDMP. Next. The Missouri Office of Admin shall provide technical, legal, and administrative support services for the Joint Task Force. But again, just drawing out that they will not have access to the dispensation information or any individually identified payable, any individual patient information. The Joint Oversight Task Force will be considered a public body and again will be subject to provisions of Chapter 610. The patient information will be submitted only will only be utilized for the provision of healthcare services to patients. So again, prescribers, dispensers, and other healthcare providers shall be permitted to access a patient's information collected for the purpose of providing healthcare services only. Next slide. There are role restrictions under the state PDMP that basically these are differences between St. Louis County's PDMP ordinance, which we are already actively participating in, and the new Missouri PDMP statute. With the new statute and the new rules, the following roles will no longer have access to the new PDMP. So again, you can see there's a large number of individuals who were provided access under the St. Louis County PDMP. That access has been removed under the state. Next. And for additional information, you were provided a copy of Senate Bill 63, and this is the web address that will take you to the statewide PDMP information, where you can learn about who is on the Joint Task Force and what their backgrounds are and purpose. But if you don't mind going back to Dean on this, I just want to open it and see if anybody has any questions.
Anybody have any questions? And thank you, that was extremely thorough and informative presentation, thank you. I'm serious, it really was. It helps a lot. Nobody has any questions?
The only thing I'm wondering is, it says that they're keeping the information, the data for 3 years. So if I know this is a further conversation, but if we share our data, we're only giving them the past 3 years then?
Actually, we will be, and Dean, please correct me if I'm mistaken, we would be authorizing the last 2 years of information, and then this would be the third, is this coming 3rd year, or are we giving 3 years?
Yeah, it's a little different. The statute requires us to delete information after 3 years. When the statute also allows us this opportunity to enter into a sharing agreement with St. Louis County to receive all that historic information. In that sharing agreement between the state and St. Louis County, it was determined that 2 years of information is what will be transferred on December 13th to the state PDMP. So from that point, December 14th, there should not be anything in there that's older than 2 years. But once that prescription gets to that 3-year time frame, it will be removed from the PDMP.
Mr. Linneman?
Yes.
Can you give us an example of, somebody that is cited with the system and how it would work? Like, say, for instance, this person is, I want you to give the example, but I'm going to give you an example of possibly,
Yep.
This person's going from one doctor to another doctor and asking for a prescription and taking too many of these drugs illegally. And what is this trying to stop? Give me an example.
Well, that's a good example. One of the issues with
and how will it do that?
Okay, one of the issues with not having all this information available for providers is that they're not going to know if, I hope no one's named John Doe in your county, but if John Doe has gone to 5 different doctors in the last week and received, we got back pain, doc, can't get over it, can't walk, those types of things,
Yep.
and has received 5 different prescriptions for opioids. That's the most common example. This information, once that medication is dispensed from a pharmacy, will be immediately, pretty much real time is the phrasing we're used, sent to the PDMP. So when number 2 looks up John Doe's information and says, holy cow, you're just here, you got a 2-week supply of some drug yesterday at Dr. Jones's office, what in the world are you doing seeing me? That's one way to eliminate the doctor shopper aspect. The other issue that, there's several, it's a tool, it's a medical tool. It allows all that information, prescriptive information, to be available to the prescriber at the time when they're saying, okay, well, do I really need to, and I'll pick on opioids, do I really need to prescribe an opioid when I see they're on a low dose opioid over here they just had dental surgery. They maybe saw someone 2 months ago for shoulder surgery, whatever the case may be. Maybe there's an alternative there that will provide the same level of pain. It does not change anything that the physician or the dentist is going to prescribe. It just provides more information so that they can make a more informed decision when they do prescribe that medication.
One more thing. I noticed going to an emergency room with a friend of mine one time, not too long ago, and there was just a lot of people there. A lot of them look like they might be going there to get a little bit more prescription. But I think if will this get them to realize, hey, I can't keep doing this because it's not working anymore. They already know.
Right.
So
yes.
Maybe the emergency rooms won't be as crowded with these kind of people. Maybe.
That could be an effect. We want the information in the provider's hands, and
eventually.
Yeah. And if those providers, we're not changing their decision on what they're prescribing. Right. But if they see, here's a pattern here, this doesn't look good to me, and the system will flag certain things like that. Again, they can have a conversation. Are you really in pain? Have you tried an alternative medication? Or are you seeking? They could ask the question, are you seeking opioids? Those are the types of interactions, additional conversation that we hope providers have.
Sounds
the same thing is also there for the dispensers. If I'm a pharmacy and I see John Doe come in my pharmacy every day of the week and they've got a new prescription, there's an opportunity for that prescription to be halted at the pharmacy. Pharmacist can call the doctor's office and say, are you aware? Provider in the state of Missouri has no requirement under the state PDMP law to search the PDMP. There are federal requirements where they must search the PDMP before they prescribe a new medication or a new controlled substance to MoHealthNet patients. So there are federal guidelines or federal law and state law that we have to kind of encompass in all of this too.
That's good. Step in the right direction.
Is there any other questions?
I have one real quick.
Yes, ma'am.
Just to clarify, the state doctor, if it's not a federal, the doc's not required to check the PDMP before they write a prescription. Is that correct?
That is correct. In the state, there is not a law in the state of Missouri that requires a prescriber, a dentist, a doctor, a podiatrist, to check the PDMP. That is a law in many state PDMP statutes. It's one that was not included in Missouri's. There is, however, a federal law. It's called the Support Act that I believe was signed into action in 2018, 2019. And that is a federal law that requires prescribers to check a PDMP prior to prescribing a new medication to a Medicare MoHealthNet recipient.
Okay, so like Social Security, somebody of that type of insurance.
Sure. Medicaid.
I guess my issue with that is if the docs aren't on board, then this doesn't work.
No, again,
right?
there is that opportunity for a pharmacist to see information as well.
But they don't have to check the PDMP either, correct?
Correct.
I think I'm so sorry.
No, go ahead.
Yeah, one of the benefits of this though, and one of the important pieces about ensuring that our historical data goes into the state database is having for those doctors that do, having the opportunity to be able to have that information, informed choice, as well as to be able to have those open conversations with it doesn't change, as you said, it doesn't change how doctors go about doing things. It just provides additional opportunities for them to have conversations with their clients.
Right,
As-
and what we're talking about, just if the county, Jefferson County, decides not to share the information with or decides not to authorize St. Louis County to share the information with the state PDMP, there would be nothing in Missouri PDMP when it goes active on December 13th for any Jefferson County patients. So as Kelly was stating, those providers that do look at the PDMP that were used to seeing information on John Doe on December 12th, on December 13th, it will not be there. So that information will not be there. They will have less information to go on when they're making those medical decisions. Just so you know, I believe you guys started with the St. Louis County program in 2017, 2018. Kelly, do you know for sure?
2017, I believe.
2017. So if the county doesn't allow data to be shared with the state, there's over 2 million pieces of dispensation information in the St. Louis County PDMP that represents those individuals from Jefferson County from that period. And that number, basically 4% of the total number within the St. Louis County PDMP. So it's a significant number. It's a significant number statewide, and it's a significant number for those providers in the county as well.
So on our end, the recommendation, I know you guys will be looking into that a little bit further in our new business, but the recommendation would be for the board to authorize St. Louis County to transmit the historical Jefferson County data to the state database so that our providers and prescribers will be able to continue to utilize that information on December 13th. Any additional question? Or sorry, go ahead.
Can I ask, we've always had an issue with disease case reporting, based on where the patient lives versus where the provider is, where the lab work is done, all those kinds of issues. So how is the PDMP data going to be put into categories? Is it based on the patient's residence?
Yes.
And if that changes?
I missed the last piece, I'm sorry.
So if the patient moves to a different county, so how does that work?
And see, I'm glad you mentioned the word county there. That is going away. The emphasis on county is going away on December 13th. On December 13th, the entire state will be required, pharmacies will be required to submit this in every county. There's 75 jurisdictions participating in St. Louis County's PDMP. If you want to look at statewide counties, there's 114, 115 if you count St. Louis City. So every pharmacy, every person, if it's a doctor who stocks his own medication and dispenses to his patients, if it's a dentist that stocks their own medication, dispenses to their patient, if they dispense a controlled substance in the Schedule 2, 3, or 4, they are required to report to the state of Missouri's PDMP. So that this county requirement or a county agreement, those all disappear because it now becomes a statewide system governed by the state law. So that little piece about, well, I won't see Jefferson County, or I won't see Boone County, or I won't see Sheridan County like I used to, that kind of disappears because it gets into the patient information for providers, and those kind of county territory boundaries disappear because it's a requirement of pharmacies and dispensers.
But there's no sharing or reciprocity with other states?
No, not at the moment. That is something that we have alerted. St. Louis County shares with 28, 29 other states. And that is something that's not allowed in the statute. And we are aware of concerns. There's a lot of border states with large population centers. We've got Kansas City, Kansas, Kansas City, Missouri, St. Louis, St. Louis on the Illinois side. Even on Iowa, look at Arkansas, Illinois, Kentucky. We understand that's a concern, and that's something we're looking to address. Based on interpretations from our legal at this point, it's going to require a statutory change. So that is something that we will have to work with the legislator to get changed to allow that interstate sharing of data.
Thanks.
All right, is there any other questions?
I have one more.
Yes, ma'am.
Just like to make note, and I want to make sure that I understand this correctly. In the second little slide clip, says treatment in 2022, 1,299 were admitted for substance abuse. But if you go down through there, only 83 were for prescription drugs out of 1,300. Only 83
As the primary. So on that one, when you're looking at it, you're looking at the primary reason for intervention. A lot of people have code disorders.
Right.
So-
Well, and I understand the need, but I think the issue is, and what we're not gonna catch here, when you weigh the share of personal information and the drugs, is the illegal drugs. That's where our problem is with fentanyl. And we can't track that. You know, and all the other drugs of that nature, so.
So one of the things that, just kind of looking at this, and Dean, please correct me if I'm wrong, one of the major shifts between the systems that we were under with St. Louis County and then moving to the statewide system is the shift or the stressing of the healthcare component of this. Whereas if you look at the types of individuals, the type of that were removed from the system, law enforcement, investigative, it's not meant to be a punitive system. It's meant to be used for healthcare. So that is one thing to mention.
Yeah, that is true. This is a healthcare tool. It's not a silver bullet by any means, but it's a tool that healthcare providers can utilize. And again, making more informed, healthier choices, healthier decisions when they're making medication decisions for their patients.
And say someone does go in for day 3 to try to get a prescription. At that point, are we doing anything to offer them any kind of help there?
As
Or
far
we
as
just
counseling,
away?
there are a
Yeah.
lot of programs in the state that are encouraging providers, educating providers on, hey, when you see this, here's an opportunity. Have that additional conversation with these individuals. Ask them, are you misusing your medication? Are you seeking those types of things? And those, I used to be in the Department of Health and Senior Services for years. And those are kind of programs that are highly funded and being incorporated throughout all the states. A lot of the opioid settlement funds are going to direct care services, direct care programs for individuals that are identified as misusing or needing assistance in handling their medications.
But they're not required to refer them for help. I mean,
I'm
it's.
not familiar with those requirements, no.
The last thing I will add is just, the state PDMP is going to be utilizing the same provider as St. Louis County. So one of the concerns I had asked about was transfer data outside the system. So as data is getting transferred, it stays in the same system. It's the same provider. It's not that the data isn't going to be transferred outside of the system. But then as well, I feel like this is really closing the loop on what we've done. In 2017, we started this process to be able to provide our healthcare providers and our prescribers with additional access to information to help our residents with healthcare decisions. And in those 6 years, we've not had issues with the system. And then looking at this, I think that we have had a really good resource for our community, and I would love to be able to see that this get continued.
Yeah, and Kelly, to add to that, Bamboo Health is the vendor for St. Louis County and will be the vendor for the Missouri program. Again, like Kelly said, there's going to be really no transfer. When this transition takes place, I kind of describe it as you're changing the header on a document. It's going to say on December 12th, St. Louis County PDMP. On December 13th, it's going to say Missouri PDMP. Everything should be pretty much identical. No change in functioning, no change in information there, unless the county decides not to allow that information to be shared. But it's going to be the same system. There will be no physical transfer of the data. It's setting in Bamboo and available for providers in the state of Missouri. Another thing, just Bamboo Health, when we put the PDMP out for bid, there were two companies that bid on the proposal. Bamboo Health was the ultimate winner. The other company was a company called Logicoi. Logicoi provides some assistance, doesn't necessarily run the entire PDMP for, I believe, Kentucky, Illinois, and Nebraska. There may be one or two others. Bamboo is the PDMP provider for 44 other states. And the state of Missouri had some connections with Bamboo previously, back in working with the pseudoephedrine database years and years ago. But Bamboo is a worldwide, world-known, renowned organization, and their primary focus is PDMP.
Does the legislation have any sunset?
No, there is no sunset in our legislation now.
Okay.
All right, I'm gonna call a close, no, sir.
I know,
I'm gonna call a close discussion on this matter because we have it coming up later, so we can do more discussion at that point in time. All right, thank you very much, sir. Appreciate that.
Thank you.
Thank you.
Thanks.
All right, we're gonna go to old business. This will be, old business is the second reading of the ordinance and harassment and discretion and act on recommendation to adopt the same. Do I have a first to do so? Motion to approve that and adopt it in whole.
I make a motion to approve the ordinance for deputy harassment.
Okay, first, do I have a second?
I'll second.
Having a first and second. Is there any discussion on this motion and point? Hearing any? Before I begin, is there a number that we're gonna put to this?
Do we need a number?
The ordinance?
Yes. It would be, I'm sorry. 23
23
11
11
30
30
01.
01. So this will be ordinance 23-11-30-01, an ordinance prohibiting harassment, discrimination, and retaliation within the Jefferson County Health Center. We have a first and second. All in favor? Excuse me, roll call vote.
Mr. Thing,
Yes.
Mr. Deal,
Yes.
Ms. Stidham,
Yes.
Dr. Henry,
Yes.
Ms. Davis.
No.
Motion passes. All right, the next on new business is presentation of the 2022 audit. Kristen, all right. Sit down.
You didn't get a pretty bound copy this time. They are in the mail and they will be available if you would like one at the next meeting. So just some quick points. It was conducted by Fick, Eggemeyer, and Williamson CPA. It was a single audit due to the amount of federal funds we now receive. The major programs that were audited were COVID-19 and adult vaccination supplemental, which we call AIG, the American Rescue Plan Act, ARPA, and Family Planning Title 10. They didn't have any concerns with any of those, so we were considered a low-risk auditee. It was a clean audit, and it will be posted on our website in the following weeks. Is there any questions anybody has?
They didn't have any suggestions?
Nope.
Congratulations.
Thank you.
Right. Very good. Good, clean audit. That's really great news. So new business, we have, number 2's been moved to the next meeting. Number 3's been moved to the next meeting. I know there was some discussion about number 4. I'm not sure over yet. This is about, number 4 is for the request of special board meeting in reference to our health center, the new building, and approving the financial portion of that through the bank. Are we in need of one?
So we wanted to ensure that we could give everybody time to look through the paperwork. Basically, the board will need to pass a resolution authorizing the health center to enter that lease purchase transaction. And so I had asked for both the resolution and the supporting documents. We got those late yesterday, and so we wanted to make sure if people had time to be able to look through them. The bank is available, and the attorneys, are available next week if people have time available to be able to go through those. But again, it's just going through the paperwork, the lease purchase paperwork.
Mr. Chairman,
Yes, Ms. Davis.
I think it's very costly to do special meetings, and I think that there's enough information that's been given to us about all that. I think we're all in agreement that to go ahead and go forward with it. So why can't we go ahead and vote on it either now or in the next next meeting? Why is there a big rush? Why can't we just agree that we'll go with it and let them go ahead and go with what they have to do?
Well, because it wasn't on the agenda. It has to be posted on the agenda for us to properly do it. So you have to have a special meeting. The reason you want to push it forward is so we can get the whole building process moving. As you know, this has been over a 2.5, 3-year project. And we really need to get it off the pie plate. And so in this instance, time is of the essence. So, and really, you can attend by Zoom, right? All we need is, I'm sorry?
Yes, sir.
I mean, that's easy enough. I mean, 2 people can attend by Zoom. 3 of us really need to be here in person. That way it is still a majority of the board here. I don't see surprises on this. I know Kelly's gonna put out something for everybody. I don't know. I'm open in the evening, so it doesn't, I can be here. I don't know about you, Dennis. So I'm good. So I don't know if there's a particular evening.
I wasn't sure if you all wanted to, since you were here together, if you had time to decide on a date and time, or if you would like me to send out a doodle poll, but whatever's easiest.
Why don't you do a survey, if you don't mind? And that way everybody can sit there and go, this is the best day and time for me, or here's my availability. We can do the best ones that way, okay? I think that's the easiest way.
That's fine.
Sure.
Although Kelly, I had trouble filling that thing out last time. I don't know why. Was it different than it, has it changed?
I don't believe so, but what I can do is just go ahead and set that up with an email itself rather than sending it to an external site to get the information.
All right. So next on our agenda is number 5, first reading of the authorization of St. Louis County, Missouri Transit, Jefferson County PDMP. We're going to step out of the water a little bit. Mr. Lederman, I think you had some comment you wanted to make on that.
Right.
Please go ahead.
My name's Alan Lederbrand, and thank you for allowing me to speak before you vote on this. I've never been a big fan of the PDMP. It's because it went overboard. Not only it's taking all Schedule 2, 3, 4, all your personal information is being stored. Regardless of that, my concern is, and I was even more concerned tonight when he said St. Louis County is sharing the data with 21 other states. So how much of the data is being shared with the federal government? Didn't really talk about how the federal government's going to access the Missouri state information. And that was a big concern of mine, because I say, well, it won't prevent you from getting a gun. Well, true, that the federal government could come in and say, okay, go ahead and get your gun. Then they'll come out and they'll look and say, well, you've been using a lot of these drugs. We're going to come confiscate the guns from you. Nothing to keep you from the federal government. Just remember, they said, with the concealed carry, federal government wasn't supposed to have access. What they end up doing? We mistakenly, the state said, we mistakenly gave all the information to the federal government. That's my concern, is who's actually, other than the state of Missouri, having access to our personal data. Now, apparently right now, 21 other states have access to the data.
I don't think it was personal data.
Well, to your drug data.
Yeah.
That's what my concern is now, and if the federal government has it, then who knows what the federal government's gonna do with it. So that's my concern is, it's a lot of my liberty was taken away. And I'm just saying is, before you vote on it, we ought to actually know who's actually gonna have and what are the restrictions, and there was no penalty. The person who gave all the concealed carry didn't get punished, nobody got punished for it. So what happens if all this data goes to the federal government or somebody who shouldn't have it? Is there any penalties? I don't see any, so thank you.
Thank you. So I do want to make mention that there's restrictions on those as in this document as far as who's gonna have access to that. And the restrictions are quite extensive, and it starts out with ATF and goes all the way through the ward of somebody. I can't read, it's pretty small.
I apologize. Yeah, I am.
And the FDA, FBI, I mean, there's a list of restrictions to them. And I do understand your concern, and I looked at it, trust me, I had the same concerns, I still have the same concerns in some respects. But I do want to say that this is really directed to those who are shopping, going around to multiple doctors. And really, the pharmacist already has that. They're already supposed to be doing that. That's a DA requirement of them, that if they catch that, they're supposed to actually report it. Them through the DEA, that something's going on. And that's where we talk about doctors, they can get themselves in trouble with the DEA for not doing things proper.
My concern was, remember, it was about meth and opioids. And now
it's always been pharmaceutical.
Well, right, and now when you talk to the sheriff, he said, well, a lot of that, it's all fentanyl.
Right.
Because it's cheaper to deal in fentanyl than to make it.
Right.
And like I said, most of the kids are getting it, is the fentanyl that's going on, and we got no control over it, so.
I get it. All right. So we have first reading. I guess I'll just need to read do I need to read the entirety, or do I just need to read the heading? So there's a resolution that authorizes St. Louis County, Missouri to transmit Jefferson County historical PDMP data, pharmaceutical drug monitoring program data, to the state of Missouri, and authorizing execution of the same. So do I have a first to approve this?
Approve the first reading?
To approve the first, well, actually, this is gonna have to be a singular reading due to the time frame. So this will be a full implementation of the reading. So this will be a one read due to the timing of this.
So what do you need, Tim?
I need a motion to approve.
To approve that we allow Jefferson County, I'm sorry.
That we allow
St.
St. Louis County to transmit the historical data of this county to the state of Missouri for their drug monitoring program. It'd be roughly 2 years.
Correct.
I will make that motion. I understand people's concern about privacy, but it seems to me that the state has gone probably overboard in protecting that. And, this could be done a lot more effectively than it has been, but it's still certainly worth.
So I have,
It saves
before we
one line.
continue on, hold on, we got a first, do I have a second before any further discussion?
I second the motion.
All right, we have a first and second. Mr. Gill, do you wish to continue on with your comments? I'm sorry, I didn't mean to interrupt you. No, we need the first, second. Is there any other comments to the PDMP?
Mr. Chairman?
Hold on one second. Transmission of the historical data. Yes, ma'am.
Could we have our council put in a clause that in no way can this be used to go against someone trying to get, to maintain their rights to carry a gun in any way that just cannot be accessed or used against them for that. Can we somehow
It's
do
already-
that? Put a protection in there?
It's already in the state of Missouri statute.
It
Jeremy?
specifically outlines that, yes, sir.
Did you hear me, Susie? Ms. Davis?
I
It's
hear
already-
you.
It's already in the statute itself, in the state of Missouri statute.
Okay, then so the clause would just simply say in agreement with the revised statute of number thus and such, we do hereby, we will allow this only under the condition that this information can never go against someone trying to purchase a firearm.
Ms.
Then
Davis,
after-
so just so you understand the purpose of this resolution, we do not have a choice on whether or not the doctors and pharmacists within Jefferson County participate in the PDMP moving forward. This resolution is to say that the data that we currently have sent to St. Louis County to be basically the keeper of our data under our current program that started in 17, they have the ability to send 2 years of data to Jeff City as part of the historical tracking. If we don't send the data, then basically Jefferson City doesn't know what any of our residents, doctors, or pharmacists have been doing for the last 2 years. They start completely fresh. Once Jefferson City receives the data, either the historical data and the data moving forward, they have to comply with the state statute. And the state statute is what actually I think you're wanting to refer to. That's already, that safeguard is already in there, as well as additional safeguards that are not currently in the PDMP in which we operate.
Okay, good to know.
All right. Any other questions?
So I had a motion, did you give a second?
Yes, I do.
Okay.
We wouldn't have discussion if we didn't. All right, so I was trying to stop. So this is a vote for the resolution authorizing St. Louis County, Missouri to transmit Jefferson County historical PDMP data to the state of Missouri and authorizing the execution thereof. What is the resolution number?
Okay. 23-11-30-02.
All right, so I'll repeat that. The resolution number is 23-11-30-02. All right, gonna call roll call vote, please.
Mr. Fig,
Yes.
Mr. Deal,
Yeah.
Ms. Stidham,
No.
Dr. Henry,
Yes.
Ms. Davis.
No,
Motion carries. All right, let's see. Now we have the first reading, number 6, first reading of the proposed bylaw presentation by our council.
Yeah. Okay. All right, so I'm going to go over, I went ahead and sent you guys the track changes, which has basically, it looks a little bit like a colored roadmap as far as where things were taken out, moved, added in. That's just for your, basically your visual inspection so you can see what we're proposing. I also then sent out a clean copy of, basically accepted the changes, fixed all the formatting and made it look a little prettier. So I'm going to go through what the changes are. I would ask that you please hold your questions of me to executive session. And the reason for that is because if you're asking for my legal advice as to why I'm recommending the changes, that is privileged communication and that is appropriate for closed session. So if I can just go through these slides and I'll just kind of let you know.
Mr. Chairman, I don't believe that's in order. I don't think we should discuss any of these things in closed session. We don't need to ask the legality of anything. If we do, that's fine in closed session, but right now, we should be able to question her as we go along, if there's anything that's on there, or make a comment according to what the matter is, and we should not save that for closed session. There are people interested in anytime we change our bylaws, it's a big deal. And we need to do this completely 100% in front of the public, nothing behind closed doors at all. So I'm saying this, sir, that we would be allowed to ask questions as we go.
Ms. Davis?
Yes,
Our
sir.
council given instruction how we're gonna do this. Your objection is so noted. If you have questions about the legality of something, we'll have to go into closed session to do that. we're not gonna parse that out.
Well, we're still gonna, I'm still going to ask questions as we go.
Ms. Davis, I will mute you. And you'll have to raise your hand, but I'm not gonna have you interrupting the council when we're going through this.
She needs to be respectful towards
Ms.
trustees.
Davis?
We are her
Davis?
boss, and
Ms. Davis?
we need to be able to, as we go, make our comments.
Excuse me, would you mute her? Thank you. Ms. Davis, we're going to continue on with you being muted, and we're gonna let the council present, and then we'll ask questions. If we need to go in closed session, we'll do such. Please move forward.
Certainly. Okay, so first slide, please. So your current bylaws, they were proposed in November of 2020, and I realized that Ms. Stidham, at that point you were on the board, but what we did with those bylaws is that we reviewed them with council in closed session in November of 2020, and I explained the reasons for the revisions at that point, got feedback from the board members, presented the amended bylaws in December. It was requested, I believe by Ms. Davis, that we table it at that point to give some additional time to review it. So we did that. We voted on those bylaws in January of 2021. So the bylaws that you currently have been in place since January 2021. Thank you. We're updating them because there's laws that change. Like, you know, we can get, for example, I mean, it's changed since the last time we did the bylaws. As we saw with our harassment ordinance that you just passed, is that sexual orientation, gender identity, those are both now included as being protected categories under Title VII protection. So sometimes laws change and you just need to go through, and it's a good practice to make sure that as laws change, you update your bylaws. We've also added in, where appropriate, citations to specific laws. So if the public wants to know where we get the authority to make specific regulations that govern how we do business as board members, and how we do business as an organization, they can have the specific citations right there in the bylaws. Also, we've updated them to allow for some more board efficiencies. Like, for example, we've incorporated the new policy that we have that Mr. Pegg implemented, where we generally have 2 readings of a resolution before we adopt it, unless it's an emergency. We've also addressed the roles of committees and how those operate, with the idea that these meetings can be short and productive, and we can move forward with the most transparency as possible. We've also gone through and done some changing to the hiring process. Right now, any termination that gets done within the department comes before the board, and that's something that we specifically wanted to be able to address, because number one, if there is a part-time janitor that we need to let go of, there is not a need for the full-time janitor to have a review before the board, unless the employee wants to protest their termination. So it gives the director a little bit of authority to dismiss people that are not director level employees, but we did carve out exception for those that were director level employees, and we'll get into those exceptions here a little bit. And finally, we just updated them to kind of conform to best practices. We look to say, okay, it's been 2.5, almost 3 years since we revised these bylaws. What's working, what's not working, what do we want to add, what do we want to do away with? So just so the public is aware, on the 24th of October, I sent a 2-page detailed summary to the board members with requests for feedback or for questions on the proposed changes. I just gave a high-level overview of what I was recommending in consultation with the committee. Today we're having the first reading of those proposed changes. What we're proposing to do is that this be adopted at your next meeting, which I believe is set for the 21st. And the reason for that is again, to give board members time, once you've read through the document, to send questions that I can answer. And if we need to make some changes, we can certainly do that. But the idea is to have it be effective at that board, be adopted at the next board meeting so that it can be effective January 1, the nice clean start date for your new books. And we would upload those to the dashboard so that the public can have access to them once they're approved as well. So next slide, please. Some changes throughout, just some housekeeping. We clarified that it's the executive director, some places just refer to as director, some places executive director. So we made that consistent. We changed the president to the chairperson throughout, and we gave consistent statutory references. Sometimes it was Missouri Revised Statute, sometimes it was RSMO, sometimes it was Missouri Statute, and you could tell that it was kind of like a crock pot of attorneys looking at it and coming up with different things they wanted to change. So we just made it consistent throughout. So getting to this, to the nitty gritty. Section 1 of the bylaws, the organization, we've now moved that the board hires the director and the deputy director. Right now, the board hires just the executive director, but this allows for the deputy directors to be appointed by the board as well. Deputy director wasn't a title that we had back in 2021. We also moved the purpose, quote unquote, purpose section of the board into this particular section of the bylaws. We've allowed for the board chair to excuse members from meetings. That's again, just basically efficiency. So if you are sick or you're traveling, you can reach out to the chairperson and get excused from being at the meeting rather than the majority of the board having to approve your absence. We've also added social media participation as an environment in which the individual trustees must utilize a disclaimer. This has been best practice. I have long advised board members to do this, that if you are speaking on matters of public health on your social media pages, that you indicate that you are giving your opinion as an individual and not as a trustee of the board. The board members have also long been instructed that if you go out in the public and you're talking, that for example, if you go to a Rotary Club meeting and you speak out on public health, that you make a statement prior to talking that I'm here as an individual, not as a trustee, because you don't have authority unless you're sitting on the dais of the board. And we added adherence to the Personal Privacy Protection Act and the Maintenance of Confidentiality section. Next one, please. We clarified the removal power. I know this has gotten a lot of questions, and what I really want the public to understand is that whenever we made these revisions initially back in 2021, we did so to provide more protections for trustees before they would be allowed to be removed. The old bylaws that were here in 2020 and before that just said, in the case of removal of a board member, we go and ask the county executive for a replacement. But it didn't say what that removal looked like. And so if you're reading that, like you would read any other action of the board, it would simply require somebody to make a motion in a meeting and to move forward. And we wanted there to be more protections for the trustees before they were removed from an office to which they were publicly elected. So that's why back in 2021, we required the censure process be used first to give kind of a shot across the bow, hey, you need to come into compliance with what you're supposed to be doing. And then if the board member didn't adhere to the compliance, then at that point we would look at removal. Despite best efforts and to make sure that everybody understood that was the intention, we continued to get questions about it. So we have clarified that removal power. I think everybody, especially in the last couple of years, if you didn't know what impeachment meant a couple of years ago, you know it by now. Even the Senate has the opportunity and the authority to impeach the president of the United States. So just because someone is elected by the public does not guarantee that they can sit in that seat regardless of what they do. I mean, even the president can be removed. So, but I understand that just simply saying removal may not have been as may not have been a word that people necessarily recognize as being something that the board has the power to remove one of its own members through the power of impeachment. So we reworded this to simply state that we have censure and impeachment to add additional protections to trustees that were not present prior to the 2021 revisions. For example, we specifically said that censure is normally required first, unless you're talking about some criminal activity that requires, removal without a warning. We would like to think that most times if trustees are not in compliance, that if it's known to them by the majority of their peers, that they would come into compliance. That impeachment vote is required by a majority, and it must first require articles of impeachment along with supporting documents. So if I'm going to go file a lawsuit against somebody in the state of Missouri, I have to specify out what the allegations are. If there are documents that support the allegations, I would refer to those. So this is basically giving the board member even more protection. You would have what is called the articles of impeachment that is issued against you, and it would say specifically what it is that you did. It would give examples of the misconduct. It would provide supporting documentation. And then within 10 days of issuance of those articles, the board would reconvene to have an impeachment hearing that is an open session. The person who is subject to potential impeachment would have the right to have counsel at their own expense. They would have the right to respond to the articles of impeachment and to present any evidence they believe refutes it or to support them staying on the board. The impeachment hearing would be open to the public and it would be recorded. And the impeachment vote itself would require a majority of all members, and all members must be present in order to vote. So in other words, if we don't have all 5 people here, then we would have to postpone the hearing because we want all 5 people to vote.
Mr. Chairman.
I'm Ms. Davis. I'm taking questions and closing.
Mr. Chairman, I do have.
We're going to continue to mute you. You will not have any questions until she's done presenting. Nobody here's ask anything. Please hold as I've asked.
We've also updated the bylaws to include our required to include the financial interest statements that are required by state statute to be filed every year. Our old bylaws, and this actually was a bit of a problem whenever Ms. Sinha was elected. Our bylaws had said at the next regular meeting after election, somebody gets sworn in. That's because prior to us moving our meeting dates, our regular meeting was always within 10 days of an election. This was the first year that wasn't the case. So we had to have a special board meeting to sit midst of them. So we went ahead and changed the bylaws to catch up to what the statute says, that within 10 days of an election, we will seat the new board members. Again, you have the right to hire the executive director pursuant to negotiated contract terms. Right now, we do have a contract for our executive director. This just kind of reiterates that. But it allows the executive director to delegate certain tasks. So now we do have 2 deputy directors, and there are certain tasks that are delegated to those deputies. And if you look in the proposed bylaw revisions, those particular duties are denoted with an asterisk next to them on the numbered itemization as to which tasks can be delegated to a deputy. It also expands the duties of the chairperson to include preparation of a rotation for board member visits. That is something that Mr. Deal set up and Mr. Pig has continued to do. That gives the chair the power to designate which trustee is assigned to visit the center on a given month. And also it details out what the purpose of those meetings are and asks that the person visiting prepare an agenda. So for example, if you're assigned for the month of December, Mr. Pig is assigned you to December, then then the bylaws say you need to say which programs do you want to review so that the director and the deputies have the opportunity to gather necessary staff to be again whenever you come, and to make sure that whenever you're coming, they're actually there that day, they can answer your questions. Thank you. The new bylaws also expand and outline the trustee duties. These are out of the statutes to include the annual report of transactions to the state auditor. It outlines what prohibited transactions and conflict of interest are based on state law. It prohibits compensation for board functions. So there is some question from that. We've had some requests from board members to be compensated for their time, compensated for expenses, and it just clarifies when we will compensate. So for example, if you're asked to go to Jeff City to represent the board for a particular issue, or you're asked to go to a training session that's out of the local travel area, that may be something that is reimbursed, but your regular travel to and from meetings is not compensable, just like your attendance at the meetings is not compensable. Also, specifies that the board has a duty to set the tax rate, hearing in September. It gives you the right to contract It outlines your relationship with the executive director. And again, all of these things are listed in state statute. Within the same section, it outlines and expands the director duties. Again, like I said, it notates which ones may be delegated to a deputy director. It specifies that she may hire and terminate non-director level positions. One of the things that did come up the day after I sent out the document is the question of suspensions with pay. So currently, like I said, only the board can terminate, and the executive director can only suspend with pay pending you all seeing a termination or a suspension without pay. Like, in other words, right now, you're the ones who discipline everybody. But under the proposed revisions, she would have the authority to terminate people that are not directors. So one of the things that we would need to discuss, and we can talk about this more in closed, is that I'm recommending that she be allowed to not just terminate, but also to suspend without pay non-director level people as well as an active discipline, that wouldn't have to come before you. And then suspensions with pay, I mean, who doesn't want a suspension with pay? It's basically free vacation. So suspensions with pay are typically only used if you had a director level position that was in danger of being disciplined, suspended without pay, or terminated. Get them off the decision. Or it also allows you to get someone off pending an investigation. So if there's an investigation of harassment, for example, it gives the director the authority to send the subject of the complaint home so that we can conduct an investigation in a bit of a vacuum. Gives the executive director the authority to negotiate administrative contracts. It moves the day-to-day operations into this section that's already within the bylaws, but I just kind of tried to reorganize it a little bit. Outlines what her role in strategic planning is, and her role as a content expert, that she serves as a public health representative, and this is a statutory duty that she has, that she approves expense accounts with the board having final approval, assembles reports, defines her role, and defines the scope of practice licensed health staff. In other words, if she has the authority, that there's a scope of practice that our doctor that we basically operate under can operate under, and the director does not operate under that scope of authority. So a good way to describe that without kind of already, but right. It also allows that her salary can be reduced if her duties are reduced. Next, we went through the committee language in the bylaws, and to be clear, these are committees of the board, not committees of the executive director. So the executive director can have staff committees. Those don't fall under your bylaws. Those just kind of fall under the operational guidelines of the center. But for board committees, it says what the purpose of the board committees are. If they are comprised of 2 board members and whatever necessary staff may be needed to properly advise on a particular topic. And the purpose of those committees is to provide advice and counsel and recommendations to the board itself. It gives a listing of what are standing and special committees. And also says that, again, because if board committees have 2 members on them, it specifically states that only those 2 board members can go to the committee meetings, because if one of you shows up, now you've got a board meeting and it hasn't properly been posted as a board meeting. It also distinguishes between the difference between a board committee versus an executive committee. Section 2 of the bylaws addresses your meetings. We have made a continued commitment to video record and to upload open meetings, even though this is not something that is required by state law. It's something that the public has been, we see how many people watch our live streams and how many people watch the YouTube clips after they're uploaded. And it's something that we want to publicly affirm that we want to continue to do that. We've also incorporated the policy about multiple readings and non-emergency resolutions, even though 2 readings, again, is not required by state law. And we have clarified the exemption for privileged communications with counsel, consistent with the sunshine law. In other words, it doesn't have to be pending litigation for us to go into executive session and for me to advise you. Any type of advice that I give you is appropriate for closed session. And we've updated the order of meetings to comply with what we do now, which is that we include a public comments. And we always have old business on the agenda, even if we don't have old business to discuss. We've also clarified the confidential documents that are in your packet. This is basically saying that if there are confidential documents that are being examined in closed session, that those will not be emailed there too. They will be provided to you at the board meeting, and the exec director may collect those after the board meeting in order to protect the confidentiality. That is current practice. Section 3, the fiscal changes. We've updated the expenditure limits, and I got an email from Kelly today. I'll be recirculating that particular. If you'll notice in what I sent you today, there's some yellow highlights because I asked for the feedback from the controller as to what would reasonable limitations be. That email, I didn't have an opportunity to change the document that I sent to you, so I will do that and I will send it to you. We also added that grant applications that are for $100,000 and above in the index must be reviewed and approved. Section 4, your operations and administration, we moved those executive director duties over into section 1, so you will no longer see them in section 4. We also clarified the hiring process for director, non-director level and director level employees. We incorporated our anti-harassment and anti-discrimination ordinance and our anti-bullying policies, which is the current expectation of all board members, but the revision makes it clear that because you are the employee body, you are expected to adhere to the anti-discrimination, harassment, and anti-bullying provisions that are in the ordinance and in the policy.
Right.
And I'll take questions and close.
Ms. Davis, before we go any further, we need a motion for approval of the first reading of the proposed bylaws. A motion to approve the first reading of the bylaws.
I make a motion to approve the first reading of the bylaws today.
Second? Do I have a second?
Second. Of the proposed bylaws.
Hold on a second. The proposed.
Yeah.
Okay. So I would first and second are the discussion points.
Mr. Chairman,
Hold on, that's gonna require us to go ahead, but it's gonna probably require us to go into closed session.
Mr. Chairman,
Yes, ma'am?
Christy Coleman can give us advice and does give us advice during and throughout our entire meeting at all times. We do not have to go into closed session for her to discuss our questions and comments about these items. They need to be in front of everyone. And it's so important. I've looked this up and I found out that we don't need anything about censuring or impeaching because it is a matter that should go before a judge. And it's in the statutes. We're not qualified to get rid of an elected board member. It's in the revised statutes of 106-220. The only reason that you can get rid of a trustee or an elected official is if they fail to devote their time. Number 2, if they're guilty of a fraudulent and willful violation. Number 3, neglecting their duty as an official.
Ms. Davis, you've been muted. I make a motion, we go into closed session pursuant to 610.021.1, reference to the bylaw discussion with our counsel for legal advice. Do I have a second?
I second.
Having a first, second, is there any further discussion? You can unmute her now, tell her that we're going into closed session. Is there any further discussion on that point? We're going into closed session, Ms. Davis. Do you have any discussions on this going into closed session?
So you have to unmute yourself. I gave you permission.
Can you unmute her?
I'm unmuted.
So we have a
This
first and
needs to
second.
be
We're into closed
in
session.
front of everyone.
It already was, it has been.
There are laws that are in the statutes
We're talking
that
about
we
going into
need
closed
to
session.
follow. We don't need to
Are you
have
going into closed
bylaws
session or
that
no?
are.
So I'm gonna call the
Who's
motion,
speaking?
roll call, going into closed session, please.
Mr. Pig,
Yes.
Mr. Deal,
Yes.
Ms. Stidham,
Yes.
Dr. Henry,
Yes.
Ms. Davis.
No, I adamantly object
Gonna
to
be
it.
in the closed session, motion carries.